and fertility consultant. So if you have been seeing all over the social medias that PCOS is now PMOS, and you're wondering, what does that actually mean? You're not alone. Honestly, I think it's a really important discussion. So let's dive in. Okay. So what is PMOS? So PCOS is being renamed. It has been deemed a bad name for a long time. And so now we're finally making some changes to actually name this disorder for what it actually is. So PMOS is now Polyendocrine Metabolic Ovarian Syndrome. PCOS stands for Polycystic Ovarian Syndrome. So what polyendocrine means is that multiple hormone systems are involved. Okay, so poly is multiple, endocrine means metabolic systems. Okay, the metabolic portion is going to be your insulin, your blood glucose or your blood sugar, you may hear it said either way, and inflammation and how that impacts your cycle and your body and your hormone levels. And then ovarian is still means kind of, we're talking about ovarian and how it impacts your reproductive organs. Okay. So the new name actually reflects what it is actually doing to your body and not just how your ovaries appear for some people. So most women, when we talk about PCOS, when it was called polycystic, so meaning multiple cysts in the ovaries syndrome, most women didn't actually have cysts. What they had were immature follicles. Okay. So when you're looking at that on an ultrasound, you're looking at a fluid-filled sac, which is called a cyst. Okay. But a cyst can be an epidermoid cyst. You can have a ovarian cyst. You can have all different types of cysts in different parts of the bodies. What? So they aren't true cysts. They were just immature follicles, but they called them cysts based on what they looked at when they're looking at an ultrasound.
Wow.
The other thing is that it made it sound like it was only reproductive, like it was only impacting your ovaries. But it also imports your metabolism, your insulin, your inflammation in your body, your mental health, your cardiovascular risk. It makes you more prone to certain disorders and certain cancers. And so I think that this name change should be a wake-up call to our healthcare team and say like, ooh, we've just been saying like PCOS women are more prone to like facial hair and obesity and infertility issues. But realistically, we need to start paying attention to this name change means that we need to really be addressing the metabolic changes that happen with this disorder. And it's not just weight gain and putting people on a GLP-1. It is about getting to educate people on what they can do to manage this disorder, because it is one of the most manageable disorders that I have worked with, quite frankly. And it's not just a fertility issue, it's a whole body issue. Again, we are more prone to certain types of cancers because of this disorder. And so I think that hopefully this helps people not be so dismissed, because a lot of times people got dismissed on, well, just lose weight or just take birth control or just take these pills to kind of minimize your symptoms, rather than really helping people understand what they needed to do to actually improve metabolic health, inflammation health, etc. And it also calls people to get a delayed diagnosis. It calls people to be confused. And this is hopefully going to help people feel more seen by the healthcare world and the healthcare team. Okay. So names matter because they help you understand how things impact the body, right? And so now we can really kind of validate that this is not just that you have some extra cysts on your ovaries or in your ovaries. It can help lead to a better and earlier diagnosis. It can lead to better care and better pharmaceutical coverage. It can lead to a better understanding for yourself, for your family, for again, healthcare team, and less shame, because so many people are just like, oh, you have PCOS, you just need to lose some weight and things are going to get better. But it's such a different disorder than that. And a lot of times people really blame themselves when they weren't able to kind of fix their problems by just losing weight, because that wasn't the problem. Okay. So what this is, again, it's a hormone, metabolic, and inflammatory condition. And it leads to being more prone to insulin resistance and having higher glucoses, which means that our glucose levels are unstable. We want them to be more steady, but you're just more prone to them being really high and then dropping down and being really low, and just having that variability, which is negative for negative for fertility, and negative for overall health. It just doesn't make you feel good. It's hard on your vascular system. It's not good for longevity. It is just not healthy. Okay. It also makes you more prone to inflammation because of this up and down kind of changes. It is making ovulation less frequent because we just don't have the right kind of precursor hormone levels that we need to trigger ovulation when we had so many follicles at one time. So what we want and what we see is that you're maybe less likely to ovulate, and it's less predictable when you do. So a lot of times women with PMOS, am I going to say that right, are ovulating, but if we don't know when, because your cycles are so irregular, we can't time intercourse for best times to get pregnant. Now, is it possible? Absolutely. But it is harder. Okay. This can also negatively impact your sleep, and it can lead to weight changes. Now, not everybody that has had a history of this necessarily is going to be overweight. So sometimes people don't get the treatment that they need because they aren't considered overweight or obese, but that does not mean you don't have it. Okay. And it does not mean that it's not still impacting your body. We are all so different. And it can kind of present in more mild to more severe forms. So this is why, if we're trying to say, how are we going to treat this? It's going to be more than just, you need to ovulate. No, we need to really fix all the other things that go around with that. So we want to, when we have patients with this, we want to make sure that we are improving ovarian quality, or ovulation quality and consistency. We want to make sure that we are maintaining those blood glucose levels and insulin levels. We want to make sure that we are minimizing inflammation. We want to improve egg quality, because if our body is staying so inflamed and our blood glucose levels are not regulated, it's going to negatively impact your egg quality because it's going to pull from those reserves. And long-term health, right? So if we know that you have some of this stuff, you may need different screenings, you may need different medications, you may need different treatment. And this needs to be an ongoing conversation with your healthcare provider so that you can get proper screening, so that you can have proper treatment, so you may have options to different interventions or surgeries if you're a good candidate. Okay. So the good news always is that there are so many things that women can do to improve these symptoms and radically improve their fertility. Wow. I feel like so many people with so many things that we can't just magically fix with some of this, but there are so many things that we can do to really improve fertility. So changing the name does not mean that all of a sudden we're going to be able to fix this condition more quickly, but I think that it says that we're putting one step in the right direction in naming this a better way, so that now healthcare providers can start thinking about like the metabolic side of things and how we need to manage that. And it also helps women to better understand like what's going on with my body, instead of being told that you just have an ovarian, too many cysts in the ovaries. That's not actually reflecting what is going on. And so I think that this really matters a lot. I think that it's important. If you've been diagnosed with PCOS or PMOS, and you still feel really confused about what your body actually needs, and do you need to go straight to IVF, or what can you do to really improve your outcomes? That is the exact thing that I love to help women do. And it changes their life. It changes your life when you can finally get control of a disorder that you've had for maybe decades, and nobody's really taught you what it means and how to manage it. And all of a sudden you start feeling better, and you want to move more, and you don't feel so sluggish all the time and feel like you're having crashes all the time. And now you're able to get pregnant on your own. So there's just, so many things that, that I hope that this makes a good change. Okay. So the names matter. They shape the care. They shape how we pay attention and how we address some of this stuff. So if you've got questions, comments, drop it down below. If there's any other topics that you're interested in learning more about, please let me know. And if you do have a history of PCOS, PMOS, I have an extensive part in my course that really highlights all of this and what you can do to start making those changes. If you are on the younger side and you're just like, what can I do? This is all of the information is going to still be pertinent. We have known that this disorder is named incorrectly for a long time. So we're not going to see like huge changes in the treatment, at least not for right now. But in the course, we kind of lay all of this out. So check it out. Let me know if you have any questions, and we'll see you next time.